Hi, everyone. So I'll just start off by sort of extending a little bit on Walter said and going over some of the methods and approaches. So again, we're undertaking this work in partnership, so co-designing with leading projects. For example, the measures that we'll talk about later, we initially started by looking at the leading project logic models. Again, we're interested in supporting learning and development, and that's for the leading projects as well as system stakeholders. And again, looking at the future of other OHTs interested in this work. And again, looking at being flexible, engaging, and interactive, and adapting to local context and stakeholder interests. So on the next slide is an overview of our methods. So we can see at the top in dark blue are those sort of overarching evaluation questions that Walter reviewed. And then we also have another subset that are secondary or have been added in as interests have come in. And those are what changes are planned, and that's really informed our early work. What factors help or hinder program success? What conditions enable successful care coordination? And what is the comparative effectiveness of the leading projects? And on the next slide, I just highlight what today's focus is. So we'll start off with what changes are planned, and then move into what are the effects of the leading projects, which we can't actually answer right now, given that they've just launched, but we're going to walk through how we're setting up our evaluation to understand this, as well as what are some of the baseline results that we're seeing related to these indicators. And then finally, looking at factors that help or hinder success, which Gaia will share. I'll just provide a little bit of the leading project. So what are they? So 7 Ontario health teams are leading the leading projects, and they've been launched to model innovations in integrated home care services within OHTs. And there are 2 overarching objectives. One is that's to test and evaluate OHT-led home care models that improve care integration, access, patient outcomes and experience, and also to build OHT capacity for home care planning, delivery, and integration. So 2 high-level goals there. On the next slide, we have an overview of the 7 leading projects. So there's a lot here, but I'll just say that they're grouped right now into and color-coded by model type. So we have in blue this sort of neighborhood models that focus on centralizing services in the neighborhoods. In pink, primary care, so that having a focus on embedding designated care coordinators and home care providers in each practice. Palliative in yellow, which is about sort of early identification of palliative care patients and their needs, and community crisis, which focuses on the sort of high-risk needs patients. There's also some differences in terms of how the implementation sites for the leading projects. So some are at the neighborhood level or practice site. They also have different scales in terms of the number of patients they are going to serve, and of course, a unique aim. And I'll actually skip over the next slide, but this does sort of highlight those key pieces. But I want to look at this. Now, this is quite a busy slide, but I just want to get it to the key points here that there's a lot of diversity in each of these leading projects, but there are some core structural elements that are the same. So for example, looking at the bottom, you have payment models and changing fee for service to a capitated rate, or IT platform and digital tools and improving those for communication. So we have some sort of core changes that we're seeing across the leading projects. There's other changes that are central to their model type, for example, sort of the embedding within a primary care practice site. And then there's other changes that are happening, or parts of the models that happen based on the context or the plan. So for example, client or community education, where some are doing it and others are not. So that is a very quick and dirty overview of the leading projects.